Hey, it's Georgie, and this is Fempower Health Audio Insights, where I break down the biggest issues in women's health so you can navigate the system with confidence. Whether you're a patient, policymaker, or provider, these insights give you the power to make informed decisions. And today's episode is something I am so unbelievably excited to share. I shared it on social last week, and it is probably one of my most shared posts yet. And they are about new guidelines that are a game changer for menopause care. And it has to do with something called Genitourinary Syndrome of Menopause. So if you're dealing with burning, dryness, pain, this is for you. So what is Genitourinary Syndrome of Menopause? Well, it may sound like a mouthful, but it is a term that every woman and every clinician needs to know, because GSM is more than a clinical acronym. It's the reason why so many women struggle with symptoms like vaginal dryness, painful sex, burning or urgency when urinating, recurrent urinary tract infections, feeling like something's off but no one's listening. So some women may laugh off these symptoms, some women are scared, and some may say, oh, but I'm on the patch, I'll be fine, or I use vaginal moisturizer. And still, your symptoms persist. But now, the 2025 GSM guidelines were developed by so many people. So they were developed by the American Urological Association, the Society for Urodynamics, which is a fascinating word, Female Pelvic Medicine and Urogenital Reconstruction, and the American Urogynecologic Society. So this leaves no room for confusion because these are the experts in that part of our body. And this is a long overdue milestone in women's health. So sorry for that context, but I just wanted it to be crystal clear how important this is, okay? So let's talk more about Genitourinary Syndrome of Menopause. So it's a chronic progressive condition caused by the natural drop in estrogen and sometimes testosterone after menopause, or due to hormone suppression like birth control or cancer treatment. And it impacts the vulva, vagina, bladder, and urethra. Now, GSM is common, so you're not alone, and it's treatable. And now the guidance is clear. So let's talk about these. And these guidelines, by the way, they represent decades of advocacy and clinical expertise. Leaders like Dr. Rachel Rubin, who's been a guest on the Fempower Health podcast, as well as Dr. Jill Kraft. They are just amazing, amazing advocates. So if you're not following them on social media, please do. They give so much education that is incredibly helpful, and the way they do it is amazing. So anyways, so here's what they confirm in the guidelines. So number one, ask your doctor about it. Normalize it, okay? In your clinicians, if you're a clinician, ask your patients about it, okay? And so ask about urinary, sexual, and vaginal symptoms. Or if you're the patient, share with your doctor your urinary, sexual, and vaginal symptoms. We shouldn't wonder. We shouldn't feel ashamed. The other is local vaginal estrogen is frontline treatment. So remember the point I made earlier, how some people may dismiss a need for vaginal estrogen because they're on the patch. Well, even if you're already on the patch, the hormone patch, or systemic therapy, vaginal estrogen is still necessary to treat GSM directly. And there's also DHEA, and hopefully I say this right, ospemifene, so it's OSPEMIFENE. They're valid alternatives. And so these non-estrogen options, so you've got the vaginal DHEA, which is also known as prasterone, and the ospemifene that I mentioned to you. They will work if estrogen isn't preferred. Here's the thing though with vaginal moisturizers. They're not enough. They are helpful for dryness, but they do not fix urinary symptoms or tissue atrophy. So they are not a substitute for medical treatment. And I will say I'm so happy that they put this in the guidelines, because so many people say, oh, I just use a vaginal moisturizer, I'm fine. So the guidelines say not enough. So what about lasers? Well, they're still experimental, so they're not considered standard of care. And if you are getting lasers, you have to make sure that there's full disclosure and informed consent. These are a must. So what about breast cancer? So if you've had breast cancer or a history of breast cancer, vaginal estrogen may be offered in collaboration with a medical team. So the good news is it's not a no, okay? The next is there's no cancer link from vaginal estrogen. So there's no proven association between the local vaginal estrogen and breast or uterine cancer. Additionally, there's no need for routine endometrial surveillance. So routine monitoring is not required when using vaginal estrogen, DHEA, or ospemifene. And then vaginal estrogen, here's a big one, guys. It prevents recurrent UTIs. So did you hear that? Prevention. This is really, really important for postmenopausal women with frequent UTIs. So let's talk about why it matters that we talk about this. So guidelines, they're crystal clear. But when you look at data, a lot of times clinical guidelines take years for them to become routine care. And that is why I put this on social media, why I am doing this episode, because I want every single person to know about this. I know there's so much out there where we get frustrated with doctors, but please understand that the amount of information doctors need to know is so much more than ever before, and the information keeps changing. And so these are the guidelines. This is what they say. I can put a link into the show notes if you want to read the guidelines. If you want to read the version of this podcast episode, that link will also be in the show notes. Please tell your friends, tell your doctors, give everyone the benefit of the doubt, but these are the guidelines. So this is why education matters, this is why advocacy matters, and it's why you might need to bring this to your provider. Doctors, again, they're inundated. So bring it up. Ask for more than the patch. Ask for more than a moisturizer. Ask for care based on the most up-to-date science. So again, I created Fempower Health because too many women feel dismissed, misdiagnosed, and alone. And a lot of this honestly has to do with the complexity of healthcare, and we need to have the proper information so that we know how to advocate as well. Everyone is doing the best they can. It's just a really, really crappy system that's making it difficult for the patient and doctor to have a great appointment, okay? So thanks to everyone for listening. Please spread the word about this episode. It is probably one of the most important updates. I know I'm a huge fan of vaginal estrogen. It can be annoying to put in, but trust me, it's not as bad. Like, to prevent all of these issues, guys, this is huge. Okay, I'm going to stop talking now. Clearly you can see that I'm excited. Spread the word. Thank you so much for tuning in. Have a wonderful, wonderful day. And if there's topics you want me to cover, please send me a note. I always want feedback. Thank you so much for tuning in.
Thank you for joining me today on Fempower Health. If you'd like to continue the conversation, please follow me on social media. I am most active on Instagram, LinkedIn, as well as TikTok. You can also subscribe to the weekly newsletter if you want to stay off social media to get the latest and greatest updates. And you can find the link to that either on my website, fempower-health.com, which is a hub to all the different health topics I've covered over the past 5 years, or you can go to the show notes where there's links to all the helpful resources that are relevant to this discussion. And if you know of someone in your life who would benefit from this information, please do pass this along, because that is how we can ensure this important information reaches those who need it most. And for anything that is discussed medically, please understand that none of what we share on Fempower Health is medical advice. It is all for information purposes only, and only a conversation between you and your doctor can give you the care that you need. Thank you very much.